So standard protocol, I would check my orders and gather my supplies, which is my tracheostomy suction kit, my tracheostomy care kit, trach ties, clean gloves, and sterile water. Okay, and then, knock knock, I'm Lori, I'll be your nurse today. We have an order for suctioning, so I'm gonna come in and do a respiratory assessment and see how you're doing. Can you tell me your name and date of birth? Do you have any allergies? Okay, so then I'll protect for privacy. And then sanitize my hands. And then I'm gonna go ahead and take a listen to your lungs, okay? Okay, sounds like you could use some suctioning. Are you able to cough for me? Okay, so then at this point, I'm going to turn on the suction. And then I'm going to hyperoxygenate my patient. Hand hygiene, and then I'm going to open my supplies. Open up my suction catheter kit. Open up my little basin. And then my tracheostomy care kit. Touching only the outside. And then I'm going to fill my little basin. And these two with sterile water. Okay. And then I'm going to open and put on my sterile gloves.
You did, so that because despite the needle not being as nice, this catheter is way much better than here. She pulled it from here somewhere. You want to use one thing?
Pull out my suction catheter. Okay. And then I'm going to uncoil it, making sure to loosen it up. And then also coil it in my dominant hand. And then I'm going to use my non-dominant hand, which is no longer sterile, and attach it to the suction tubing. Now at this point, I'm going to test the suction. Okay, it works. Coil it, and then I'm going to remove the oxygen. And then I'm going to have you take a deep breath, and I'm going to insert the catheter 6 to 8 inches. Okay, and then I'll be twisting as I use intermittent suctioning and pull it out, lasting no more than 15 seconds. I'm going to coil it back in my clean, sterile hand. And I'm going to go ahead and listen to your lungs again, okay? Okay, you sound a lot better. During the procedure, I will monitor for signs and symptoms of hypoxemia. Okay, making sure that my patient's oxygen saturation and heart rate is okay. And at this point, if he needed additional suctioning, I would clean out my tube. But as he doesn't, I'm going to discard my supplies. Take off my gloves. Wash my hands. And then turn off my suction. Okay, at this point, I would put on clean gloves. And then remove the inner cannula, touching only the outside area. And I'll put it in my cleaning solution. Okay, take off my gloves, wash my hands. And then I have another pair of sterile gloves. This will now be my sterile fill. Then I have my new dressing. Some extra gauze. And then some trach ties, which I no longer need. Then I'm gonna grab my inner cannula. This head is no longer sterile, and I'm gonna clean it inside and outside, and then rinse it in my clean solution. And then I'm gonna go ahead and replace it, and then snap it into place. My hands are no longer sterile, so I'm gonna remove the old dressing. Okay, and then I'm gonna assess the stoma and the peristomal skin for any signs and symptoms of infection, any drainage. And I can take my Q-tip. I can go ahead and clean and dry around the stoma. Okay. And at this point, I will go ahead and put on new trach ties, leaving the old ones in place until the new ones are secure. Excuse me, put this over. Then I'll go ahead and remove the old trach ties. In the garbage. Go ahead and I will replace the dressing and gloves. Okay. Okay, tighten these up for him. Replace his oxygen. And I'll go ahead and clean up my supplies. Turn my oxygen back down, and then I'll go ahead and complete my respiratory assessment and document the procedure and the patient tolerance.